Before we begin today's meeting, we acknowledge that we're in the traditional territory of the Anishinaabe peoples in the Huron-Robinson Treaties area. We recognize the long history of First Nations and Métis peoples on this land, and we show respect to them today. We acknowledge that we have important neighbors, the Wattamohawks and the First Nations of Moose Deer, Shawniga, Wasauksing, Magnetawan, Henley Inlet, Nipissing, and the Dokies. As we're learning from our First Nation partners, we need to stress the importance of accepting our responsibility to take care of Mother Earth, her plants, her animals, and our shared peoples. We look to each other and the elders of both nations as a source of inspiration, guidance, and the living memory of our communities. We must ensure that the decisions we make today will take into consideration the future of our children and that of their children's children. And as settlers on this land, we're grateful for the opportunity to meet here, and we thank all of the generations of people who have taken care of this land for thousands of years. So I will call the meeting to order. The addendum added some correspondence in item 5, and it also added a closed agenda item that'll be a verbal report from our Chief Administrative Officer. With those changes, could I have the approval of the agenda? Thank you. Is there any pecuniary interest or general nature thereof to disclose? No. Okay. I have a motion that the Council of the Corporation of the Township of Seguin does hereby adopt the minutes of the regular and closed session meetings of Council held on September 16th, 2024 as circulated. Could I have a motion to that effect? Gail and Terry. All in favor? Thank you. I have a motion that the Council of the Corporation of the Township of Seguin does hereby adjourn the regular meeting to hold a public meeting for the following matter. Zoning bylaw amendment application number R 2024-0020-H for 1000604-548 Ontario Inc. Could I have a mover? Mario and Ken. All in favor? Council will now hold a public meeting for a proposed zoning bylaw amendment application. In accordance with the Planning Act, Council will consider all matters placed before it prior to passing a zoning bylaw. Anyone wishing to receive notice of the passing of a zoning bylaw amendment and who has not submitted such a request in writing should provide your full name and address to the clerk. No one other than the prescribed persons may appeal an application under the provisions of the Planning Act. If they do not make oral submissions at a public meeting or make written submissions to the Council of the Corporation of the Township of Seguin prior to the decision of Council, then the Ontario Land Tribunal may dismiss the appeal. The purpose of zoning bylaw amendment application number R 2024-0020-H for 1000604-548 Ontario Inc. is to rezone the lands to permit a warehouse public self-storage facility as an additional permitted use in the C3 zone. I now ask the clerk to state the method by which notice of the meeting was provided and the dates on which that notice was provided.
Notice of the public meeting was provided by posting the property, posting on the Township of Seguin's website, and by regular mail on September 6, 2024. Notice was therefore considered provided in accordance with requirements of the Planning Act.
Has the Township received any correspondence with respect to this application?
Correspondence has been received from the Ministry of Transportation, Ontario, and various persons stating no objections to the application.
Is there anyone present in person in the council chambers? Obviously not. Has anyone registered to speak to this application via electronic participation?
Steve Fawn, our agent for the applicant, has registered to speak via electronic participation. He isn't here yet. There's another gentleman who hadn't registered but was here. He's logged in as Taylor. That is supposed to be speaking to the application. If you just ask him.
Is it Mr. Taylor?
It's just Taylor M.
Taylor M., are you online for this application? Could you identify yourself and what item you're here to speak to?
Can you hear me?
Yes, we can.
No, I'm not necessarily here to speak. I was just here to watch, if that's allowed.
It certainly is. So thank you very much. Does council have any questions on this?
Yes, I do, Mayor. I don't know where
Go
my,
ahead. Yeah, go ahead.
yeah. My only question is, I guess this might be for Taylor. That I noticed that there are some photos on this report and the land was cleared. And I was just wondering, was permission already given for the clearance of the land prior to the zoning bylaw amendment?
I had been to the township and I spoke to Ashley Blow, and she said that we were allowed to clear up to 80% of the property without any special, I don't know, anything special from the township. We
So
also,
is-
oh, sorry.
Yeah, I'm just wondering if this is new or not. That prior to, there was land cleared. So I'm just wondering if this is proper or not. I don't know.
Two questions. First of all, Taylor M., could you identify yourself with your full name and last name?
My full name is Taylor Monbourquette.
Would you mind spelling that? Just because we have to keep a record of it.
Okay, so my first name's Taylor, Taylor, and my last name is Monbourquette, Mombourquette.
Great. And your address?
36 Indian Crescent, and that's in Port Carling.
Okay, thank you. Now, the other Taylor, our Director of Planning, could you reply to Councillor Collins' request about the land clearing?
Certainly, Your Worship. The proponent would have been advised that our tree cutting and site alteration bylaws don't apply to this lot, since it is not an EP zone or within 60 meters of a lake. So there are no municipal restrictions on clearing.
Does that answer your question, Councillor Collins?
I'm just wondering when the lot was actually cleared. Does anybody know?
We started clearing it last December. We got a burn permit from the township to burn some of the brush.
Mm-hmm.
And they probably finished mid-February, I would think. The main reason for the clearing was because we figured we'd have to do a little blasting. We just wanted to see how much.
Okay. And so there's no, there obviously hasn't been no blasting done.
No.
Okay. Okay, that's it, Mayor. Thank you.
Thank you. Any further questions from council? No. Thank you. Council will now close the public meeting and reconvene to the regular meeting. And with that, I have a motion that the public meeting of the held for the following matter is hereby closed and the regular meeting is hereby reconvened. And that's for the zoning bylaw amendment application number R 2024-0020-H. And then I have a motion that, oh, sorry, can I have a mover to move? Mary and Greg, sorry, all in favor of going back into regular meeting? Thank you. And now I have a motion that bylaw number 2024-098, being a bylaw to amend the Township of Seguin zoning bylaw number 2006-125, property roll number 4903-010-008-19200, application number R 2023-0026-H, for 1149 Lake Joseph Road, 10000604548 Ontario, Inc., is hereby deemed to have been read a first, second, and third time and passed by council. Could I have a mover for that? Gail? And Ken. Thank you. All in favor? Thank you. So that has passed, and good luck with your business.
Thank you very much.
Council will now consider the following road allowance application. Shore Road Allowance Application Number RAS-2023-0014-H for Halkiotis on Lake Rosso, bylaw number 2024-093, and Shore Road Allowance Application Number RAS-2023-0006-H for Smith, and RAS 2023-0007-H for Martin on Clear Lake Road, bylaw number 2024-091, Shore Road Allowance Application Number RAS 2023-0008-H for Park, and RAS 2023-0009-H for Park on Clear Lake, and that's bylaw number 2024-092. Have any written objections been received related to these applications?
No written objections have been received.
Is there anyone present in the council chamber who wishes to speak to these applications? Okay, we'll move on. Has anyone registered to speak via electronic participation?
No one has registered to speak by electronic participation.
Does council have any questions on any of these? Nope. You do them one by one? Is that how it goes?
We're going to do them all.
Okay. All right, so I have a motion that bylaw numbers 2024-091, 2024-092, and 2024-093 being bylaws to close, stop up, and sell various portions of Shore Road allowances are hereby deemed to have been read a first, second, and third time and passed by council. Could I have a mover? Ken, thank you. And Councillor Getty. All in favor? Thank you. So all three Shore Road allowances are passed. Oh, this is a deeming that goes with motion that bylaw number 2024-094 being a bylaw to deem lots 1 and 2 of Plan 194 pursuant to Section 50 bracket 4 of the Planning Act not to be on a plan of subdivision, property roll number 4903-010-002-04200, file number D 2023-0011-H for Halkiotis is hereby deemed to have been read a first, second, and third time and passed by council. A mover, Marion and Greg. All in favor? Thank you. Okay. So, item 6D is the concession road allowance application. It's for information only, correct? I think it's Ashley. What's Melissa? Taylor, can you speak to item 6D, the concession road allowance application, a little bit?
Certainly, Your Worship. This is a request being forwarded by the applicant to purchase the portion of the concession road allowance behind their lot. You look on page 150 of the council agenda, the area in red is the area which they're inquiring about purchase. The municipality would retain the part in blue as it has public works potential uses. If council gives direction, we can proceed to the next step, which would include engaging surveyors and the actual transfer process.
Thank you. The costs of the survey and those kinds of things are to be borne by the applicant?
That is correct.
Okay. Any questions from council? Nope, I don't think so. So I would understand that you have council's agreement to go to the next step. Okay. So we move on now to delegations, and I believe, Mr. Rutley, that's you for the West Muskoka Trail Riders Snowmobile Club. And you have a very complete report in your agenda package on page 155. It's similar to one we've had from another snowmobile club. I will read it, put it on the table. Have a motion that bylaw number 2024-099, being a bylaw to authorize the execution of a memorandum of understanding prescribed snowmobile trail land use permission between the West Muskoka Trail Riders Snowmobile Club and the Corporation of the Township of Seguin, is hereby deemed to have been read a first, second, and third time and passed by council. Could I have a mover? Greg and Ken. Does anybody have any questions for Mr. Routley on this application? Nope. Nope. All in favor? Thank you. So that's passed. You have what you need. Thank you. Thank you for coming. Now, I believe you're going to let Ellen Walker and Jess Farger-Lee into the meeting. Ellen, can you hear us?
I sure can.
Okay, there you are. We don't seem to see Jess online.
Yes, unfortunately, Jess had to go home with a migraine. I think she has what I have, which is why I'm also joining virtually. So unfortunately, she's unable to attend today. So it'll just be me.
Okay, well, welcome. Ellen Walker is the manager of the Rosso Nurse Practitioner-led clinic. So over to you. You have the floor.
Fantastic. Thank you so much. I'm just going to share my screen here. Okay, and is everyone able to see that there?
Yes, we can. Thank you.
Fantastic. Okay, so I won't be able to see any questions while I'm doing this, but toward the end, I suppose if there are questions, hopefully there will be time for that. So good afternoon, everyone. So as Mayor mentioned, I'm the manager of operations for the Nurse Practitioner-led clinic that's owned and operated by the Westbury Sound Health Center. So that includes management of all 6 of the Nurse Practitioner-led clinics, including Rosso. And I wanted to first off just thank you for having me here today to talk about our Nurse Practitioner-led clinic. And again, just really looking forward to answering your questions at the end of the presentation as well. And also thankful for the option to attend virtually. As you can probably hear from my voice a little bit, I'm working through the end of a cold and hopefully won't impact the presentation too much today. So at the Westbury Sound Health Center, our rural nurse practitioner-led clinic, we really see primary care as key to the broader healthcare system. It's all about how we connect with other departments within the Westbury Sound Health Center, how we collaborate with outside organizations, and how we work with our community advisory committees that are in each of the communities that we serve. And we cover a really large area that's widely spread out. We have an aging population that's dealing with more chronic illnesses than ever before. And on top of that, we're seeing a shift as more retirees and people working remotely are, settling in West Parry Sound, it's really changing the makeup of our community. And being one of Ontario's top seasonal destinations, that also brings its own dynamic too. And so, as you all would be well familiar with, we have around 16,500 seasonal dwellings in the district and over 300,000 visitors to Killbear Provincial Park, and some of the busiest travel routes, both by highway and water. We're proud to support the communities that we serve, and we've built a really strong history of collaboration with local care providers, with health and social service organizations, with municipalities and hospitals both north and south of us. As an example, the Nurse Practitioner-led clinic itself, we provide medical oversight and work very closely with community paramedicine. We partner with the Parry Sound Family Health Team on system-wide improvements in primary care. We work closely with Ontario Health at Home to provide home and community care overflow services at our nurse practitioner-led clinic sites. And we share rapid access addiction medicine programs with the Canadian Mental Health Association. And those are just a handful of some of the many partnerships and shared programs that we have formed through this nurse practitioner-led clinic model. In our work, I had mentioned earlier our partnerships with Health and Social Services Network. And so this involves about 15 organizations within West Parry Sound, from the District of Social Services Board, all the way through to us here in primary care. And we've come together with a few key goals in mind. That is the quintuple aim that is put forth by Ontario Health. So first, we want to enhance the patient experience. So this means that we are, working toward delivering high quality patient-centered care that truly meets patients' needs and it builds trust. And one of the main ways that our MPLC is doing that, one of my favorite ways that we're doing that is through our community advisory committees. And what that means is that we're looking to include patients' voice in building of those programs. We've been doing that in many different areas to date, but we're hoping to expand on that as well. Second, we're focusing on improving population health. And I think this is where, municipalities really come in to continue to be great partners, where, we're looking at ways to boost overall health outcomes, but also, looking at reducing disparities among different groups to improve that overall population health. I think we can all agree after the pandemic that health doesn't exist in a silo, that there's so much that surrounds health that impacts that overall population well-being. So we're also working on improving cost efficiency. It's about using our resources wisely, cutting unnecessary costs, removing duplication of services where we can, bridging programs together, and working toward improvement of services with cost efficiency, but never at the expense of quality care. We're also committed to supporting the well-being of our care teams. So we all know well that in the north, and particularly in the rural north, we often have retention and recruitment challenges for human health resources. And one of the things that I'm really proud of from our MPLC is that we haven't had the level of challenges that others have had. And there's a number of reasons for that. Some of it being that our staff are paid at the hospital level. And the other piece to that is that we make sure that we address burnout, we manage workload, and we create a healthy environment for the people delivering care. We know that our care providers have to be at their best to be able to provide their best care. And so part of our work here is to ensure that they are well as well. And finally, we want to improve health equity. So we're looking at, we need, to make sure that everyone has fair access to healthcare, and this really involves addressing social determinants and making sure that no one gets left behind. So that's another piece where I look forward to continued partnership with the municipalities. I'm going to skip past this one a little bit here in an effort to keep this on time, but I just wanted to highlight all of the different areas within the hospital here and how we all kind of work together. We have primary care, emergency care, acute care. So that's the full range of inpatient and outpatient programs. That's got palliative care, mental health services, and on-site relationship with home and community care. We've got long-term care, and many community collaborations, including 8 municipal governments that we work closely with, and 15+ members of that health and social service network that I was chatting about earlier. And here, this is just showing kind of where the MPLC fits in terms of total staff with the rest of the team. And I just wanted to highlight it because we aren't the little MPLC that we once were. We're approaching 40 staff, which makes us the largest nurse practitioner-led clinic in the province right now, which is really exciting for Little Perry Sound. Little but very big, very Perry Sound. And then a look at some patient numbers a little bit more depth. So this is sort of numbers across the whole West Perry Sound Health Center that Jim Hanna had provided me. And with the emergency department specifically, I wanted to note there's 18,000 patient encounters annually at the emergency department. Our MPLC here is closing in on 24,000 patient encounters. And I wanted to just note that that is only our core MPLC staff. So that is the original funding from 2018, which includes 8.8 nurse practitioners. It includes 2 mental health workers and 1 physiotherapist. And as I'll explain, as I kind of go into the nurse practitioner-led clinic model a little bit more, we've expanded those services massively through partnerships. And actually in 2023, we just about crested 85,000 patient encounters at all 6 of our nurse practitioner-led clinics. So we are very, very impressed with the model and how it's been able to expand services into the rural areas. So how have healthcare needs in our rural communities changed? The local population is expanding. I chatted about, retirees and work from home professionals making the permanent move to cottage country. And that increases the need for comprehensive primary healthcare in these rural areas. Further to this, we have, it's not just that we have more people out in rural communities that we're looking to serve. Our aging population has increased the need for expanded healthcare services that are available to manage more complicated health issues. So an example of what we've done to meet that need is around, we have a community-enhanced geriatric team, which includes specialized nurse practitioners and other team members to care and move that program forward. So in 2018, and this piece I am hopeful that you are all familiar with, but in 2018, West Perry Sound Health Center was awarded funding to expand its 6 nursing stations into nurse practitioner-led clinics. The level of care provided by each MPLC site expanded to include a physiotherapist and 2 mental health workers. The Ministry of Health Investment increased our patient encounters for comprehensive primary care by more than 5,000 per year. Further, this investment included an administrative lead, which is me, and at the time, clinical leadership as well through Katie Hogue that now has passed over to Teresa Wetzler. And the role of myself and Teresa is really to drive partnership development, looking at designing, building, and implementation of programming to meet the community needs, and also to provide oversight to all 6 sites. So what does our rural MPLC look like and why is it special? I would like to see this model in many rural communities across our province. Our MPLC is special because more than 75% of our service populations are rural community members. We have multiple sites and our service area is huge. It spans almost 6,000 square kilometers from the southern Moose Deer Point site near MacTier to the northern site, which is near Port Loring. And in addition to this, our MPLC kept its association with the West Perry Sound Health Center's Board of Directors and Senior Leadership, which is the first ever partnership between an MPLC and an acute care facility. And the reason this piece is really important is, in Ontario, as we move toward integration and building, better transitions, that was built into our model from the get-go. So what has happened here is that it has allowed us to maintain this high level of access to healthcare services at the hospital. And it also smooths integration and transitions between hospital and home and vice versa. I'll keep this really short here, but just wanted to show that Victoria Langley is our Chief Nursing Officer. Katie Hogue was our former Chief Nursing Officer, who I think you are all quite familiar with because she used to be the MP in Rosso as well. And so myself and Teresa, we report into Victoria. Oh, my dog is whining. We have a collaborative clinical administrative leadership. So it's myself, Ellen Walker, and also Teresa Wessler. And again, we oversee all 6 of the NPLC sites with a nurse practitioner lead manager at each of those sites. So in Rosso, the lead for the site is Brittany Lebrec. So how are we meeting these demands? So a good example from the former nursing station model with the 6 sites is that we saw 15,000 patient encounters as described. And now with the nurse practitioner led clinic model and the addition of extensive community integration partnerships. So for instance, we work with the District of Social Services Board, income support and stability workers who come out to our sites once per month to each of the sites. We work with community support services, geriatric navigator who comes to a different one of our sites every day. That schedule has changed just recently. We have a dietitian that was coming out to Point of Barrel. We have foot care at a number of our sites. We have this geriatric enhanced program, rapid access addiction medicine program, and various programs that our community advisories have brought forth as well. So more on the community advisory committee. I think that we have a few members, or at least one member from our community advisory committee in Rosso here today. And our community advisory committees provide formal advisory to Donald Sanderson, who is the CEO himself of the hospital. But they also provide advisory to the programs that we run and assist us in fundraising to provide those services. So for instance, in Point of Barrel, the CAC funds provided a dietitian and foot care services in the community with management and oversight from the NP manager there. In Rosso, our CAC recognized the need for seniors to better understand the many services available to them, and that was in partnership with Seguin Township. So they assisted us in running a health fair in collaboration with Seguin Township. Just a moment, sorry. Further, so our CAC now, with assistance from a significant donor, the Rosso CAC recognized that ongoing episodic appointments for cottagers are really important to the community, especially in the summer, and raised funds to, in conjunction with a significant donor, to run the walk-in clinic that is managed by the NP manager in Rosso, and that runs on the weekends in the summer. So here I'm going to just really take my time, and I assume that there will be some questions around this. So I just want to make sure I'm clear on this. So the Rosso NPLC nurse practitioners must provide the following. And I say must because this is where our Ministry of Health contract comes from. This is our evergreen agreement for the funding that we are provided for our nurse practitioners to work from Monday to Friday. So primary care for registered Rosso NPLC patients without another primary care provider, including assessment, screening, diagnosis, and management of simple and complex chronic disease. Then because we are so integrated into the communities, we know that there are needs beyond this. So as capacity allows, we are providing short-term care for patients without a primary care provider who are waiting for registration through our unattached patient clinic. There are referral forms for that as well that I'm happy to distribute. This program has been going on for quite some time in Point of Barrel and Whitestone, but we are getting it launched up here in Rosso as well. We've had a few patients through so far. And then second to that is we have episodic care for those who are not on the NPLC roster, including care of minor illnesses or injuries and certain short forms. Now, again, these extended services are only as capacity allows. And I'll speak to you a little bit about what that capacity looks like in Rosso right now, because it does differ from some of the other sites. So what types of appointments are available at the Rosso NPLC? So we have regular appointments Monday to Friday, 8:30 a.m. until 3:30 p.m. We are closed for lunch. And those regular weekday hours are funded by the standard government programs. That's through our Evergreen agreement. We provide primary care appointments. We can book, those can be booked during regular hours by phone or in person for patients on the NPLC roster. And then same day appointments can be booked as above for simple concerns as availability allows. And again, those regular hour appointments, we have to prioritize registered patients to the Rosso NPLC. So summer weekend appointments. So this was part of the work from the CAC. So the weekend summer hours are provided by generous donations from our own community, and they are raised by representatives from our CAC. And as I noted earlier, also the generous donation from one specific donor. And again, these are episodic appointments that can be booked by anyone with or without a primary care provider for simple concerns only, both in advance and same day. So this is the part that I think is perhaps most important to make sure that everyone is, understands where we're at right now. So we're very thankful that we have the addition of allied health providers like our community geriatric registered practical nurses and additional physiotherapists who will be up and running hopefully by October. With those additions from various programs and partnerships, Rosso was able to register over 150 patients from our waitlist in the last year. That said, anyone on the waitlist after July of 2023 hasn't been included in the latest round of registrations due to capacity limits. So our waitlist, those 150 patients, are all people who have registered up to July of 2023. And so I think that gives you a bit of an idea of just how long the waitlists are for primary care. So we're optimistic that with future investments, we'll be able to expand services in Rosso and other rural areas. And we're also hopeful that the support of the Westbury Sound Ontario Health Team will help us develop a regional strategy to improve patient attachment and also access. We're committed not only to providing attachment to patients, but also to providing quality and accessible care to the patients that we serve. And I think this is something that to date we've done really quite well for our registered patients. We did submit an expansion proposal, and it's been on the Ministry of Health's radar for 5 years now. We knew shortly after we were awarded the first funding, we knew that it wasn't going to quite meet the need. So we have been on this for 5 years, an annual submission awaiting funding. This proposal is backed by solid data, and in our opinion, a really strong track record of designing and implementing programs in collaboration with many community partners. But I think that we have to also recognize that there are other areas in the province that don't have the largest nurse practitioner clinic in the community and haven't increased their encounters quite as much as we have yet. So we're hopeful that with more investments coming forward in the next couple of years, that we will be named there and we'll be able to expand further. So I'm going to stop there and just end on a thankful note. Just that on behalf of our team, the patients, family, and communities we are privileged to serve. Thank you for your leadership. Seguin Township specifically, we've had a lot of fantastic work done with your group recently, and look forward to doing that more. And our door is always open to assist you and your staff. If you ever have any questions, please feel free to reach out.
Thank you, Ellen. Council, do you have any questions for Ellen? Councillor Bazinski.
It's more of a comment than a question. My daughter has her 1-year-old grandson of mine registered at the clinic, and she sings great praises of your clinic.
Wonderful. Thank you so much.
Councillor Finson.
My question, it's not a question, it's fair, that's a comment. As you know, West Parry Sound District has not one walk-in clinic in the entire district. I live in Rosso. I'm in a community where there's a lot of senior citizens that can't go and wait 9 hours and emerge to see somebody when something happens. They no longer can use the clinic as they have a primary care provider. So what my question, or I'm going to speak around, is it appears that if you get donations, you can do that in the summer and provide for the people who come in the summer. Why can't something like that be done with an extra nurse practitioner for the people who used it before it became a nurse practitioner run clinic? These are people who have to have a primary care provider. I understand they have a doctor because they're old and they have issues. So I just wondered if there's not some way that we could take care of that part of our community that has been using that nurses station and raised money for it. So, and they can no longer use it. So it's a big issue for me. That's my ward, is Rosso. So I get a lot of calls, a lot of not great feedback, but I know it's doing great work. I know that. I'm aware that of the great work that the nurse practitioner-run nurses stations do, but that doesn't matter. I can talk myself blue in the face, but if we don't reach out to them and provide them something, sometimes that provision that you've just told us about gets stopped at the front desk, and it's unpleasant. So I'm just wondering if there isn't a way we could, as you know, we don't have walk-in clinics here. We just don't have them in the entire district, not one. So I'm wondering if there's a way we can include or provide for the rest of the year, not just for the 2 months of the summer that somebody has generously donated money for.
It's certainly a question that we hear a lot of, and it's a very valid gap, right? And it's a gap that we, that I think that as a region, we have to come together and figure out how we're going to address it. I don't have the answer for Rosso from a primary care perspective right now. But I do think that it's something that is a question that, it needs to be addressed. And I'm hopeful that as we work toward this OHT, that we are going to hear that over and over again, and in most of the communities that we go to. And I think that's something that we will have to address as a community. And how do we move forward, and how do we make sure that those episodic appointments are available to patients when they need them?
And as I say that, I work at the health unit too, so I am familiar with all of the nurses' stations, and all of the phone calls come through, when I'd be working there, come through the health unit. But it's hard to explain to people that they can't go there when they live up in Point Barrel and they have to go to emergency. So I'm glad that you're thinking about it at least, and working on that. That's progress. Thank you.
Absolutely. And I would say too that Point of Barrel specifically, Rosso and Whitestone are just about at capacity. Point of Barrel does still have room on their roster. So if there are patients there that are unattached, please get them to reach out if they do come forward.
Thank you.
Thank you.
Any other questions? Councillor Getty.
Mine's not really a question. Mine's just a statement. I've had the opportunity of working on the advisory committee since I came on council. And I think that it's worth mentioning. I see Suzanne Powell is here today in support of the nursing clinic. But I think a thanks from me as the council representative to Suzanne, Phyllis Finson, and Rosie Whitaker for the work that they do in the community. I think a lot of people don't realize how much time and effort they put in. The results of that culminated, I think, this year for me in seeing the partnership that they, as well as Ellen, developed with the staff at Seguin Township. And I think it's a relationship that is going to move forward and benefit our residents over the next number of years. Dominique O'Brien and facilities have been working now, as opposed to us working individually on a building. The Seguin Township owns the building that the clinic operates in, now works in partnership with the facilities people at West Perry Sound Hospital, so that if, by the grace of God, at some point, the ministry will provide more funding for an expansion, that as things are repaired and move forward in the clinic, it is with the planning that the coordination between the two. So there's not a waste of money or a waste of time or resources. If they are successful in getting another nurse practitioner, any work and renovations that are taking place in the basement now are coordinated so that they meet the standards that are required for those facilities to operate as a nurse practitioner-led clinic and or a hybrid / walk-in clinic, summer walk-in clinic. So thank you to the advisory committee and to staff and to Ellen. Thank you.
Thank you
Thank you, Greg.
Thanks so much,
Just
Greg.
one question. You said Point of Barrel still has capacity. Are you saying that someone that lives in the Rosso and catchment area that has transportation could have a family physician at Point of Barrel?
Not a family physician, a primary care provider, which is a
A
nurse
primary
practitioner.
care provider.
Yes.
And if they went to get that, would they then automatically be taken off of the Rosso list? Or could they still remain on the Rosso list as they potentially lose the ability to drive themselves?
So we are one nurse practitioner-led clinic with 6 sites. And so my suggestion would be that, yes, they could go on that list if there is capacity elsewhere. and that they would remain on the ROSA list because ultimately, as everyone knows, and age and transportation challenges down the road, it's better to be closer to home, would be my suggestion. And I think that could be made pretty clear in an application in Point of Barrel as well, to say that you are still on the list in Rosso, and hoping to get on there when availability comes up.
Okay, thank you for the clarification. Any further questions? Thank you, Ellen, very much for your presentation and helping us understand. And I hope you feel better.
Thank you so much for having me.
Thanks so much. I have a motion that the Council of the Corporation of the Township of Seguin does hereby receive staff reports as presented on the agenda for October 7th, 2024. Could I have a mover? Terry, and a seconder. All in favor? Thank you. Okay, I think the first is the planning report about how we handle peer-reviewed environmental processes, and I believe that's Taylor. It's a pretty comprehensive report we have in our agenda package, but Taylor, do you want to simplify it verbally for us?
Certainly. Through your worship, we typically have two routes to obtaining an environmental impact study. We either require a peer review, which that's a situation where the applicant will go out, they'll hire their own environmental biologist. We'll take a deposit from the applicant and our biologist peer reviews it. There's typically some back and forth, and then the recommendations get implemented. We tend to do more contentious or more complex files. The other approach is municipally directed, where we typically do on files where we don't foresee a lot of problems or a high level of contentiousness. In that situation, we take the deposit, we send out a request for quotations to a handful of biologists that we work with. The applicant reviews and selects the bid. We take the money and we pay them, and then everyone agrees to abide by the terms. The main difference is municipally directed, they pay for it, but the biologist works for the township. Whereas peer review, there's two biologists involved. The first biologist works for the applicant, and the second biologist works for the township.
And I mean, it's very comprehensive in our agenda package. Does anybody have any questions? I think staff is recommending that we continue with both streams and that they choose the file that each one goes on. Do I see your hand up, Ted? No. Okay. Councillor Bazinski. Oh, sorry,
Nope.
Ted, do you have your hand up?
No, I don't. I'm agreeing with the approach that Taylor has just recommended.
Okay, thank you. Councillor Bazinski.
Yes, I think I raised this because historically we had the previous type of approach where an applicant would hire their own consultant, and on the contentious issues, we typically would get a peer review done of it. On the non-contentious issues, it seemed to work well. The one difference I find now, and I've discussed it with Taylor, so it's no mystery, but it's very difficult to get a biological consultant right now because I guess they have so much work on their plate. I know I had some of my constituents raise this as an issue because it seemed like one consultant was getting all the work, and it winds up that that one consultant is bidding on the work and not many others are. So I tend to agree that right now it probably goes a little bit quicker, because if the township directs the consultant, typically, unless like on one recent application, there was a lot of contentious issues, it makes it go more quickly and doesn't cost a lot more. So I'm satisfied with the report.
Thank you. Thank you, Taylor. I think you're still on deck for item 8B, which is the updating of Shore Road allowance fees. And again, it's a comprehensive report. Does anybody have any questions for Taylor on the proposed new fees?
Yes, I do.
Okay,
I'm trying to
Councillor
find my
Collins.
little, yeah, I'm sorry, Mayor, I'm trying to find my little hand, but yes, I agree with this, better sooner than later. And I seen on the report, it'll go into effect just after this meeting. And it's about time. It's been, what, 11 years since this has been updated. And I'm gonna go along with staff on their fees and some, how many was there today that were pretty lucky? Of the road allowance. So I'm agreeable to the thank you.
Any further questions? Taylor, go ahead.
I'd just like to note, Craig pointed out the fee will become applicable most likely in November. That's when council will decide upon the fees bylaw. So it won't be tomorrow. Council says one more bylaw to pass, but it should be at the next meeting, I believe.
Did you say the next meeting, Taylor?
Sorry, 2 meetings from now.
Oh, 2 meetings, okay.
That's when the election.
Sooner than better.
Okay, well, we'll look to Taylor and the clerk to follow the right process. But I think we're all in favor of increasing the fees as soon as you can. And it looks like you're also going to continue to look at what shore road allowances cost in neighboring jurisdictions. Okay, thank you. So you have council direction to go ahead. Strategic initiatives, the update on the strategic and operational plan I found very informative, and I think it's going to be Forrest on this one. Yes. So Forrest, thank you for the comprehensive report. Do you want to do a little summary briefly? You guys have been busy. You people.
Through your worship, I'm happy to introduce it. I think ultimately, at the end of the day, if there's questions around specific actions that we've reported on, it would be best suited to the director responsible for those actions. But by and large, I'm quite pleased to present this update report. Ultimately, I'm hoping that this process matures along the way and maybe eventually have a bit more of an interactive portal where council can kind of follow along. We're getting there. But as far as the process goes, I'm happy to answer any questions around that, or if council wants to field any questions, specific questions to the actions included in the table that accompanies the report, we can do that as well.
Okay, thank you. Do councillors have any specific questions? Councillor Bazinski.
Thank you, Mayor. Couple of things that I wasn't, well, I think when you talk about the issue of carrying capacity, it's like waving a red flag in front of my face. So I think I may have misinterpreted, but on the water quality aspects, I thought maybe we might be talking about the septic reinspection program. I didn't notice it in there, and that to me would have a more direct impact on the water quality than the carrying capacity issue, which really is an official plan issue. That was the one thing. And then the second was with respect to introducing climate change principles in our purchasing. And I generally agree with what's there. I just think we need to go with very small steps, one at a time, simply because I know I talked to one of the municipal representatives in the town of Parry Sound, and they say they park their truck in the wintertime, which is electric, and they can't get it working. And I'd hate for us to buy a snowplow, for example, and it wouldn't work in the wintertime because the batteries wouldn't allow it. So those are the types of things. I'm sure maybe after I'm gone, by that time the electric will be perfectly running, but there's still some issues. So I wouldn't say we would never buy any electric vehicles, maybe, like a bylaw vehicle and so on, but heavy equipment is still, we want to be very careful with it is all my concern is. Thank you.
Through the chair, when it comes specifically to, well, I guess we'll start with the septic reinspection. In talking with Curtis, we believe that determining whether to continue with the septic reinspection program will be contingent upon taking septic permitting in-house, which is a project that's underway in a different, it's a different process. Now, specific to climate change procurement, I believe next council meeting, I'll be bringing forward that draft procurement bylaw. I think you'll find that we have pulled together a very pragmatic way of considering those sorts of sustainable procurement pieces within the procurement envelope. It's in some ways it's easy to go too far one way, but we looked at it very much to align with the standard asset management, life cycle planning, and the entire way we look at useful life cycle of assets of all types. So stand by for that update.
I look forward to it.
Thank you. Any further questions? Ted?
Thank you, Mayor. My only, an excellent report, Forrest. I have to admit, you've touched on all bases, and my only concern is right now we have no outside funding for anything moving forward, and I think that that has to be crucial moving this forward. I could see that I went to the all departments and noted that you have submitted applications for grants and they haven't been approved. So, and now we're down to where you've noted, and God bless you for noting it, in the absence of funding, the commission, whoever that commission is, haven't got that commission yet, do we? Is that still in the planning process, the commission?
Through the chair, I believe you're speaking specifically about the airport project listed, and that is with the commission presently.
Yeah, okay. And it looks like moving forward on that transformer portion of the project, it said to avoid further delay, the costs are going to be estimated at $3.5 to $5 million. And I'm wondering, where is this right now, presently?
Through the chair, presently, Neil, the airport manager, is working with funding agents, both provincially and federally, to explore opportunities for funding on more of the economic development side, those being key drivers of the business park side of the airport. And it's my understanding that some good conversations have occurred and continue to.
Yeah, I'm sure our CEO is still working on that as well. So, okay, thank you.
Anybody else? Do you want to talk a little bit to it?
Thank you, Worship. Members of Council, it's part of the process of strategic planning, of course, was to be able to not just have a document that sits on a shelf, but that lives and breathes and is active every day. And of course, to ensure accountability throughout the organization, we needed to develop a reporting framework. This is the first step at it. As Forrest noted, he's done an excellent job of preparing what's in front of you today and tracking and hounding on senior management to make sure that everything's up to date routinely. But this will evolve over a period of time, but our commitment was, of course, to get some form of reporting back to council and to the community to say we are advancing those strategic objectives. And as you can see, there's a ton of work going on, and we do continue to move the bar forward. There's lots of details that I could get into, but I won't. I'll keep it at the 30,000 foot level and just suggest that this is the first iteration. We welcome your feedback as you digest this and see if there's something different you would like to see, if there's something missing, if there's something you'd like added or deleted from this list. And this format, let us know. We're open to the feedback. We want to make sure that we're getting it right for you. And this was our first kick at the can, so we're open to that feedback. I think that's enough for me today.
Okay, thank you. I think it's very useful. And I heard Forrest allude to the fact that this might be online in the future where anybody could check in on their pet project or whatever. And I think that's a goal. The one comment I was going to make on, I guess these are page 187, where you've got increased collaboration with clubs, committees, and other organizations through the fundraising team of the rec center. I think we've probably got a very comprehensive list of all the clubs, organizations, ranging from cards, euchre to wrestling, and women's wrestling. We have a women's wrestling club in Parry Sound. So if they want some lists, we've got them. Councillor Bazinski.
I just wanted to follow up on Jason's comments about public involvement. Will this ultimately be on the website or communicated to groups and so on in the township?
Through you, your worship, you know, I mean, I suppose technically this is a public document at this point, and so it's open for public viewing. I think Forrest and I have had some conversations about a much more digital interactive type platform where someone could go in and search and look up specific information if that's what they're looking for. We're not quite there yet. That's going to take a few iterations to get there, but everything's a process, and this is one where, you know, we've got some stuff documented. We're able to at least now demonstrate we're making progress on strategic initiatives, and certainly we'll hope to have a very public-facing, interactive something widget in the future.
Okay, Councillor Getty, did you have your hand up? Okay. Thank you very much. As a first step, it's pretty comprehensive, so thank you very much. We move on now to 8D. Michelle with the financial update.
Yes, thank you, Your Worship. This is the financial update to September 27th. It's fairly comprehensive, and I would be glad to answer any questions that council may have.
It is comprehensive and it's going in the right direction. It's got some ways to go yet, but anybody got any questions? Councillor Bazinski.
If we come to the end of the fiscal year and we're in deficit, do you have a plan to apportion the money to different accounts, or how would that work, Michelle?
Through Your Worship, there are various ways you can deal with the deficit at the end of the year. You can fund it from reserves, or you can carry it forward into the following year to be funded by next year's tax revenue.
I'll just piggyback on that, and I'll remind council the driver behind the current deficit position was that spring weather event that wreaked havoc on our road network, and we do have a reserve in place for significant weather events. And as that initial report, and Michelle can correct me if I'm wrong, identified at the time, we could have used it, but we said let's try and manage through the year and see if we need to tap into that reserve or not in the future. So I think we're trending in the right direction, and it looks good. Hopefully we get there by year end. If not, there may be an ask of council to consider dipping into that reserve for whatever may be there or carrying forward, as Michelle noted.
Thank you. Thanks, Michelle. We move on to business. And I believe this is for our information from the municipality of Whitestone, a letter directly to the Near North District School Board. You may recall over the previous and current terms of council, all mayors objected to the mega school and the population numbers that the Near North Board was using to build the mega school. So obviously Whitestone has dug in their heels here to ask for the elementary schools to be reconsidered to stay open. It's here for your information. Does anybody have any comments? Councillor Bazinski.
Sorry, I seem to be in a talkative mood today, but in terms of this plan, does that mean that the Humphrey School would be closed and that the students would be schlepped out to Parry Sound?
I don't believe there's any mention of Humphrey here.
Would it be possible to have the school board representative maybe by Zoom at the next council meeting to give us an update and so on? Because if that was the case, I'd want to strongly object as well to you know, our kindergarten to grade 6 students going to a high school environment, because quite frankly, for a number of reasons, busing them in, and secondarily, you know, in, you know, kindergarten and grade 1, 2, 3, et cetera, students going into a high school is not a very good environment as far as I'm concerned.
Through your worship, my understanding, and I don't claim to have all the details here, but my understanding is at this point, the Humphrey Public School has not been considered for closure. This is strictly focused on the 2 schools in McDougall, the McDougall Public School and the Nobel Public School, and their proximity to the high school, I think, is the driving factor behind it. But again, to the best of my knowledge, there has been no discussion about touching the Humphrey Public School in any way, shape, or form at this point in time.
And I will echo that when the mayors met with the Near North School Board, Humphrey was identified as a relatively new building compared to McDougall and Nobel buildings. So there was an age of building that went into that, as well as they're much, much smaller than Humphrey in enrollment. Councillor Adams. Oh, sorry.
I just seen here on there was talk of building a new McDougall school. Because I know I've heard rumors that the new school is over capacity already. So I'm just wondering has there been any rumors about a new school in McDougall? Because that doesn't make sense to me.
Not that I've heard, but the way they've written it is that be considered.
That's what they want, but I just want to know if there's.
I guess this was sent to us for information, but if we would like to echo it as a council, we could bring it back to another meeting with a similar resolution. Councillor Bazinski suggested we have the school board rep at the next meeting. We do have an elected representative in Howard, what's his last name? Howard is our elected representative on that school board. We could invite him to speak at a next meeting if he would like. I mean, he is the representative for here. And perhaps that would be a first step before we did our own resolution. Councillor Getty.
Thank you, Mayor. I was just going to echo as well what Jason and the mayor had said. My understanding, speaking to people, is that the Humphrey Public School is not on the list to be mothballed. But as a township, we have to be cognizant of the fact that if they do close those 2 schools north of Parry Sound, the potential stress on this school, because there is going to be a lot of parents attempting to transfer their children into this school, which is over capacity now. So we as a township have a responsibility to be cognizant of that as well. Thank you.
Thank you.
Yeah.
So is that falling your bailiwick to possibly invite somebody? Thank you.
Yeah, Mayor.
Councillor Collins, yep.
Yes, that was Howard Wesley. He's the.
Thank you.
Yes, you're quite welcome.
Okay, so we have a next step there. And then the next one, 9B, is also for information. from the town of Perry Sound requesting support really for insurance and licensing, as I understand it. Does anybody have any comments or questions on this one? I'm not entirely sure it is as relevant to us as in a contained area of Perry Sound where rideshare can kind of take the place of taxis. Okay. So we move on to item 10, and I believe Michelle will speak to this. I have a motion that bylaw number 2024-080, being a bylaw to establish development charges for the corporation of the Township of Seguin, is hereby deemed to have been read a first, second, and third time and passed by council. Could I have a mover and a seconder to put this on? Thank you. Okay, Michelle, you've done some background work on this, I know, and lots of calls. So do you want to take us through what is a very comprehensive bylaw?
Thank you, Madam Mayor. This is the culmination of work for the last 2 years to bring a development charges bylaw to the township. As you'll recall, we had a statutory meeting in August. Council made some suggestions about what they'd like to see in the development charges bylaw. And there were some recommendations brought by Hempson back in September. This development charges bylaw encompasses those changes, which were essentially to provide a discounted rate for entry-level homes and an exemption for small non-residential construction. So this is the bylaw that will bring development charges in effective January 1st, 2025.
It's very comprehensive and a heavy read. Does anybody have any questions? Councillor Bazinski.
So Michelle, there was talk before that there would be an area-specific bylaw and then there would be a specific one for the MZO lands. Is that still the plan?
That is definitely still the plan. Madam Mayor, through you to Councillor Bazinski. The area-specific bylaw will be specific to those MZO lands and will cover water and wastewater costs.
Thank you.
Yes, what we're discussing here is township-wide, not MZO. Councillor Getty.
Thank you, Madam Mayor. Michelle, I think it was talked about when it was first presented. In regard, are we going to tie these to the CPI so that we don't have to come back every 2 or 3 or 4 years to increase them? I know there was some discussion in the initial report as well.
Through you, Madam Mayor. There was some discussion about that. The bylaw will get reviewed every 3 to 5 years. And for the life of me, I can't remember, Greg, to be honest, about the CPI. I'm looking to Jason, perhaps.
– Thanks, Michelle. I do not believe we've tied this to CPI, given it was our sort of first crack at development charges in with plenty of work ahead of us to finish through this. We don't frankly expect this to sit for 5-6 years before we come back for review. We expect to be back sooner than later. We can make those amendments at that point in time, but at this point we suggested not to proceed. As I recall, we've suggested not to proceed with a CPI.
Perfect. Thank you.
Councillor Bazinski.
Council not too long ago passed a resolution to put aside a reserve for capital projects, roads and so on. Does this affect the development charges bylaw? Because now you've got you're going to have, you know, the whatever it was, 1% or 1.5% of tax money that's going to go for infrastructure, and then you're going to have development charges that's going to go for infrastructure. I'm just asking, how does that work?
Through you, Madam Mayor, the way that the development charges are calculated are based on the infrastructure, the capital expenditures that the municipality will incur because of growth. Some of those expenditures, as you saw in the development charges background study, some are specific actual new growth, some are an expansion of services. And you saw that there were some revenues that were offset against some of the expenditures. Some of those revenues, some of that funding will come from that particular asset management reserve. As it stands right now, I don't believe there was anything in the next 3 to 5 years in that background study that came specifically from that. But I would imagine as that reserve grows, that will change probably in the next iteration of the development charges.
Thank you. And you'll note that we now, once this passes, we will have a development charge reserve. It's a whole different pot to manage, and that's pretty clearly explained around page 270 to about 275, that's where the funds will sit from the development charges. Okay. Councillor Collins, any questions on this one?
No, I was just gonna say that 1.5% is that we've agreed back last year, and it's in the budget for this year, is pertains to the asset management plan moving forward for infrastructure that we already have that are
Correct.
depleted. Yeah, so.
Okay, we have a motion on the table. All in favor to pass the bylaw? Thank you, and that is unanimous. That's a big step for the township. Council reports. Number 1.
Excuse me, September the 25th, I attended the Recreation Culture meeting. September the 26th, I attended the West Prairie Sound Museum meeting, starting the budget process for 2025. September 27th, I attended the DPSMA meeting held in Point of Barrel. It was a well-attended meeting from different municipalities. October the 1st, I attended the lunch with the mayor for the businesses in Seguin, held at the Seguin Valley Golf Course. It was well attended and a lot of new faces from the last time I was there. October 2nd, I attended a lunch and learn at the Foley Hall. Guest speaker was Tom Smith from EMS. Tom talked about the new senior program through the EMS. I'd like to thank Tom. I had a call on the bridge on Ferris Road that goes to Rainbow Lane, and I didn't realize apparently the work has to be done by the railroad. And Tom was quick to respond on that for me, so I just want to thank Tom for that. Other than that, the phones and emails were quiet since the last meeting. Thank you.
Thank you. Councillor Bazinski?
Oh, sorry.
Yes, I attended on 27th of the month. I attended the Parry Sound Municipal Association conference. It was well attended and very informative. On the 1st, I attended the mayor's lunch and met a few business people, and that was very, very beneficial. On the 2nd of October, I was able to attend the IceCap meeting and listen to their program going forward. I unfortunately had to disengage before we talked about the costs, so I'll look forward to getting that information. And then on the 4th, I attended Muskoka Watershed Council Summit on the environment. And it was a very interesting one. There were a number of speakers and talking about trying to preserve the water quality. And it was very interesting because they involved First Nations and youth groups from the area as well. So to get a perspective from the youth growing up in terms of what the watershed means to them. And that's it.
Thank you. Councillor Getty.
Thank you, Mayor. I'm opposite of Ken. I was quiet for meetings, but lots of phone calls. I did attend the flag raising for the Truth and Reconciliation last week. It was well attended by staff. I've been quiet in regards to the Police Advisory Council. Give an update on that. I just, as we came into the meeting, it looks like that is finally moving forward. It was supposed to start April 1st, but we will have our first meeting on October 17th up in McDougall. They're administrating it for the West Parry Sound District graciously. The only should mention that early look at the reports show that we had a spike last year in property crime, and we've actually had a 62% decrease this year, year to date compared to last year, and an 11% decrease in violent crime, which is good to hear from the community side. Thank you.
Thank you. Councillor Fellner.
Thank you, Mayor. I as well attended the Seguin Recreation Committee meeting. And wanted to point out that subsequent to that, I've talked to Michelle, and if people want to donate to this year's Christmas dinner, they can make a donation to the township by check, citing Christmas dinner, and Michelle will take the money and manage it and send them a charitable receipt for anything over $25. So that's, we also discussed perhaps some way that we could, for different events for the Recreation Committee, perhaps there might be a way we can take a machine to other events and raise funds. But right now we don't have any way of differentiating what those funds would be for. So there's probably a little bit of work that needs to be done there. I also went to the mayor's lunch, and it was very well attended, and I had a great time. I think it was a good event. Congratulations to the mayor for hosting such a good lunch. I couldn't move for about 4 hours afterwards, but and that's no emails, not a lot of calls. So that's it for me.
Councillor Collins, do you have a report?
I certainly do. I attended one conference, the District of Parry Sound Municipal Association meeting in Point of Barrel last month on the 27th. Again, that was well attended. And I guess you could call the mayor's lunch an event. I also attended that, and I'm not going to speak further on that. I'm going to let the mayor expand on such a successful event. Thank you.
Thanks. Councillor Finson.
I had a Belvedere Heights meeting, Finance Committee. They discussed the new beds. All the finances are in good order, and the Finance Committee had no negative comments about finances. They're in good shape. I had another Belvedere Heights meeting on the 25th, the board meeting. The board's talked a little bit about the reserve funds and going forward with the 22 beds. They've got a photo of the plans. It's pretty lovely. I think it's going to be a really good thing. That was on the 25th. I also had a recreation culture meeting on the 25th, and somehow I'm doing the volunteers for the turkey dinner again. Anyway, it was a good meeting, and the Halloween Howl, I have to kudos to Terry and Samantha. They're just amazing. Like they've got this. They've got, I'm going to go the day, and it's just a delight to work with them. Really, really good coordinators. Really good. On the 30th, I had a Pumpkin Fest meeting, going really well. The donations are amazing. Everything is on point. Everybody's doing their job. Really nice committee this year. A lot of new people, like at least 5 new people. So we're really fortunate to have newcomers, like they haven't been on any committees before. So really pleased with the Pumpkin Festival Committee. October the 1st, I went to the mayor's lunch, which was really well attended, had a wonderful time, and the food was amazing. The food was really good. Also had a meeting at the Russell Hall about fundraising for the Russell Hall. We're not quite ready yet, but we do have a committee of 6 and some pretty good people on there that are also new. So that's nice to know. My sister-in-law being one of them. Anyway, that was really nice to get her on board. On October the 2nd, I had a Russell Caring Community meeting. Fabulous group of people, really well organized. We're ready for our first lunch and learn next week. And so they've got all their ducks in a row. So we're really, really excited about our first lunch and learn. So that's all I have. Thank you.
Thanks very much. I attended on September 19th, the Canadian Mental Health Symposium in Foley. It was very informative and unfortunately very specific to West Parry Sound and some of the mental health challenges that are being faced, particularly by our youth in this area, and a lot of substance abuse. So it was very, very interesting. I'm not sure the solutions are as interesting or as easy to come by. And also on the 19th, we had a pool fundraising. I should refer to it as the Recreation Center fundraising, but we are all calling it the pool. September 21st, I think I was the only one from council that attended the mystery dinner in Foley, and it was lots of fun. There were a few murders. And I think the rec committee did a great job of organizing it. On the 26th, I had the privilege of speaking to the retired teachers of West Parry Sound about the Recreation Center, and I'm quite amazed. Their donation level now is at $11,200, and they're all on fixed incomes. And they're amongst the most generous group for the rec center, and those dollars will be matched by the anonymous donor. So it was really something to meet these people, some of whom were in their 90s, and they're writing checks for the rec center. The 27th, as some of you mentioned, I was at the district meeting in Point of Barrel, beautiful place for a meeting. And a reminder that Ted, as our board rep, has invited that organization to meet in Seguin at the Orville Center next autumn. So put your thinking caps on for dynamite, important, relevant guest speakers that we need to be thinking about. The 30th was National Orange Shirt Day, and we had a flag raising and some photos. Also that afternoon was the West Parry Sound Health Center biannual Zoom meeting update with Donald Sanderson. A few of us attended. And on October 1st with the mayor's lunch and golf, and I don't take any credit for organizing that. It was done by volunteers, led, I think, by Donna and Valerie. They sorted out the reply system halfway into it. And on our business committee, it was Mike McMillan from Sargent and Lori McDonald from the Russell General Store that made it come together, got the door prizes, got everything done. If you have any feedback about how the 3rd annual Mayor's Lunch should proceed, we'd like it. There's some talk about should it be a breakfast instead of a lunch to get more people out, so instead of interrupting their business day. Should there be golf or should there not be golf? What time of year is best? The marinas didn't like our October 1st date because they're putting boats away, but they didn't like the spring date because they were getting boats out. So I'm not sure there's a perfect day, but we really do want feedback. And Donna has taken all of the invitation lists from all of the members. Some of the council gave it and some of our committee gave it. And out of that has created the beginning of a business directory list. We've got 160 names on the list. Some of them we can't tell what kind of business they are, but we've got an email for them. So at some point we need to expand it. It is not our goal to catch anybody running an illicit business. It's to say, do you want some help from Seguin? Can we help? Do you want to network differently? So if you think, I will at some point, once we're a little bit further down with the business list, I will circulate it and say who from your ward may be missing. But certainly it's only to help the businesses. It's not to catch anybody. And then on the last Thursday, we did have a bit of a debrief, and the food was good and it was incredibly affordable what Seguin charged us. Less, just $2,100 to feed almost 100 people. So that's all I have, and over to you, Jason.
Thank you, Worship. Seguin Township will launch its holiday food drive early this year to help address the growing demand in our community. Donations will be accepted starting this weekend at the Rossall Pumpkin Fest and continue until mid-December. The community is encouraged to drop off donations at the municipal office and community centers over the coming months. All donations will go to Harvest Share and Parry Sound. The Township's Recreation and Culture Committee is hosting its second annual Halloween Howl on October 31st from 5 to 7 p.m. at the Humphrey Community Center. This is an opportunity for families to participate in various games and activities, including Trunk or Treat in the parking lot. Details are available on the Township's Facebook page. The Rossall Memorial Hall fundraising teams had its first official meeting, as Councillor Finson noted. This group will help to raise funds required to restore and renovate the hall, so stay tuned for upcoming events and initiatives from the group. And just wanted to take a moment with a special thanks to the faculty and staff from the Humphrey Public School for bringing dozens and dozens, multiple classes over to the Truth and Reconciliation flag raising ceremony and engaging in that important event as the students and us continue our learning journey about the history and the pathway forward as with respect to truth and reconciliation. So special thanks to principal and her staff for bringing everybody over. That's it for me, Your Worship.
Thank you. I have a motion that the Council of the Corporation of the Township of Seguin does hereby receive the board and committee minutes and agendas and the correspondence as presented on the agenda for October 7th, 2024 meeting of council. A mover. And Ken seconded. All in favor? Thank you. And I have a motion that the Council of the Corporation of the Township of Seguin does hereby proceed to a closed meeting at 4:01 p.m. in order to address matters pertaining to litigation and potential litigation, including matters before administrative tribunals affecting the municipality or local board, and that is the notice of appeal for zoning bylaw application number R 2024-0012-H for Lucock at 174 Hamer Bay Road. The security of property of the municipality or local board related to cybersecurity. Personal matters about an identifiable individual, including municipal and local board employees related to human resources matter, and a proposed or pending acquisition or disposition of land by the municipality or local board. All in favor? Oh, sorry, I need a mover. Oh, okay, Terry, and a seconder, Greg Getty, all in favor. Thank you. I have a motion that the Council of the Corporation of the Township of Seguin does hereby rise from a closed session and declare the regular meeting reconvened at 5:19 p.m. Terry Fellner moves it. Who seconds it? All in favor? Thank you. And I have a motion that bylaw number 2024-100, being a bylaw to confirm the proceedings of meetings of council, is hereby deemed to have been read a first, second, and third time and passed by council. Gail, I need a seconder. All in favor? Ted, you're not voting. I have a motion that the Council of the Corporation of the Township of Seguin does hereby adjourn this regular meeting of council at 5:20 p.m. in order to meet again on Monday, October 21st, or at the call of the mayor. Gail and Mario. Happy Thanksgiving, everybody. And I really encourage